Hello, in this video I'm going to be talking about lymphedema. What is it, who's at risk for it, and how to manage it. Before I go on, I'd love to invite you to subscribe to this YouTube channel. We're always putting out new content. Often when you ask us for a particular topic, there's always something new to watch. I'd also love to invite you to go to yerba.com to get your personalized yerba report. So what's lymphedema? Lymphedema is swelling of the arm and sometimes the chest wall, and actually one can have lymphedema over the entire body due to other causes. In breast cancer, we tend to see lymphedema in the arm on the side the cancer was, in the chest wall, sometimes even in the back. People have had sort of extra fluid collections. As you can imagine, this can be really distressing for people. If it's left untreated and it gets more severe, it can decrease the functioning of your arm. It can make your arm look different, and this can lead to people being very self-conscious about how the arm looks. And there's no reason to trivialize this side effect. This is an important side effect to know about, and to know that physicians, physiotherapists, occupational therapists care very much about decreasing the risk of lymphedema, and if it occurs, treating it. So why does it even happen? Well, when you have breast cancer surgery, the lymph nodes or glands under the arm, that's where the breast tissue drains. So our body has a blood system and it has a lymphatic system. And the lymphatic system, lymph is this milky white substance that's in the blood that actually gets put into a lymphatic channel and drained through the lymph nodes, and the lymphatics takes out foreign bodies. So if you have a tattoo, you can actually see the ink picked up in a lymph node, for example. They pick up things that shouldn't be there: bacteria, fungus, tumor cells. They do a whole host of things, and we take those out to determine the stage of the cancer, which helps us figure out the best way to treat the cancer. And also, by removing any positive lymph nodes, we can decrease the chance that the cancer comes back in the armpit and lymph nodes that are above the collarbone. But in removing those nodes, it disrupts the lymphatic channels. So removing the nodes just sort of takes out part of the system. If you think about these as channels like waterways, you're taking out part of the channel by removing the lymph nodes. Now, for many of us, the lymph will just be redirected in different directions, and recent research has shown that new lymphatic channels can actually be formed, so that this doesn't happen in 100% of people. And if it happens, it's not always permanent. It's just important to recognize it early. So how do we go about recognizing it early? Well, very subtle changes. I'm going to show you with my hand that people with lymphedema might say, I can't close my hand, it feels really tight. Or my rings are tight all of a sudden. Or my watch is leaving a deeper mark when I take it off at night. Or my clothes are tight. And this can be in the arm that was operated on. Very rarely, I would say probably 1 in a few thousand people do we see it on the non-operative side. And we can also see it in the chest wall. People can describe, this is after you've healed, sort of a bogginess or fullness. And when you wear a bra or otherwise any compression to the chest, it leaves a deeper mark. We can see this after mastectomy. We can see it after lumpectomy. So if your bra on one side is leaving a deeper mark than on the other side, that's a sign that there's lymph, most likely, backed up in those tissues. Radiation is another thing that can increase the risk. So I didn't mention that, but I do want to mention that. And if you've had radiation after a lumpectomy, you could be at higher risk than somebody who omitted radiation therapy. You can see we're trying to treat people with as little treatment as possible, but also not shortchange people on treatment. This is why we don't do a lymph node dissection on everybody if their sentinel nodes are negative, or if 1 out of 4 is positive, because we want to do less treatment to decrease the risk of lymphedema. Used to be said that higher weight, higher body size was a risk factor for lymphedema, and that's not true. It's probably part of what we know of as body shaming. So your weight status alone will not increase your risk for lymphedema. So I mentioned that recognition early is important, that tightness when you try to make a fist, your rings being tight, your watch leaving a mark, your bra or clothing leaving a mark, that's a good time to talk with your medical team. You can talk with your surgeon, you can talk with your oncologist, you can talk with your primary care doctor, and what you would like is a referral to physical therapy or occupational therapy. It's my guess that some people are doing this virtually so that you don't have to drive all that way, though the first assessment, it's usually really helpful to be seen and have your arm measured in 3 different places compared to the other one. If you've had breast cancer on both sides and lymph node dissection on both sides, that can be a little tricky because while the lymphedema may be worse on one side than the other, you don't have a quote normal arm. You don't have a baseline arm to measure. So if you've had breast cancer, lymph nodes removed for whatever reason on both sides, that can be a little tricky, but you'll still find those measurements can be really helpful, showing either asymmetry and or progress as you get better. The ways in which this is treated are through massage, trying to get that lymph tissue not to establish itself in the channels where it doesn't belong. So a lot of massage, some exercises will be taught to you as well. You can wear a compression garment and a gauntlet. A garment will go all the way up your arm and a gauntlet goes on the hand. Some people find that the gauntlet is not necessary and actually makes the swelling worse. So there'll be a little bit of trial and error. If it gets really bad, there are actually machines that you can be hooked up to that will lymphatically drain the arm and move the lymph up in a mechanical way. So it reproduces a physical therapist or occupational therapist or other lymphedema specialist, but it's something you can do at home. So there are a lot of options. The key is, the bottom line is, catch it early, reach out for help, don't say it's not too bad, because we want to keep it from getting worse, and don't lose hope. Thank you so much for watching. We'll see you again next time.